Assalamu alaikum wa rahmatullahi wa barakatuh. A very good day to you and welcome to this edition of Pregnancy to Parenting. And as we focus on breastfeeding just after baby's born, we've taken baby home and hopefully established feeding and breastfeeding mechanisms within the maternity home or the hospital, private sector, wherever you found yourself giving birth to your baby. Looking at how Nurse Brandt is going to be explaining to us, a breastfeeding consultant and commonly known as Auntie Kathy at the Al Nisa maternity home, as she gives mom's guide to breastfeeding, even to the point when mom goes back to work, she then trains the nanny. So really hands-on as Nurse Brandt is, and she's been trained as a breastfeeding consultant. And firstly, let's first find out who Nurse Brandt is all about. A very good day to you, Auntie Kathy, Sister Kathy, Nurse Brandt, all of those names you've mentioned. Welcome, and thank you so much for joining us today on Pregnancy to Parenting. Tell us quickly, who is Nurse Brandt? Tell us a bit of your background, who you are and how long you've been in this industry.
Oh, I'm a lot of people. I'm actually Katharina Brandt.
Okay.
But I've got so many names. I'm Auntie Kathy, I'm Sister Kathy, and so on. I actually start my nursing career in 1984.
Okay.
And I do the course of auxiliary nurse in a Tygerberg Hospital. Okay. So then when I started with nursing, that was actually my passion. I thought nursing only was my passion at that time. I can remember it was 1991 when I actually was removed to the obstetric department.
Okay.
And at that time I fell pregnant with my firstborn. And after that I was working in the labor ward.
Okay.
And then moving to the Sony department. And then we moved actually to Melkbos. That was quite far from Tygerberg to Melkbos, and I resigned there. I work in Milnerton ICU. I resigned there. Obstetric doctor from Tygerberg asked me to come and work at Litsa. I resigned there, where Dr. Adam grabbed me to come and work at Al Nisa maternity. Yeah. And this is actually the place where my passion for nursing started. I was trained in 2003, 2006, and also 2011 for the 20 hours of breastfeeding, but I was so shy to open it. I can remember one day while I was standing in the butchery, there was a guy coming and I had this badge on.
Yes.
And he said, "Oh, I see you're a breastfeeding counselor. My wife is sitting there in the car and she had a problem like breastfeeding, and I had to go to the car and actually assist him and ask her what's wrong." And eventually at Al Nisa maternity, my passion actually started from nursing. So I will say I'm a very devoted person. When it comes to breastfeeding, I will give my best. I will go a mile with the patients if they really wanted to breastfeed.
Thank you so much for that introduction, Nurse Brandt. Now tell us quickly with regards to breastfeeding. We've heard the unlimited benefits of breastfeeding.
Yes.
Please give us, and also the importance of it, please tell our viewers your point of view when it comes to the importance and the unlimited benefits of breastfeeding quickly.
I will actually say, I will start by the pregnant mommy. Breastfeeding actually starts not at breastfeeding when baby is born. Breastfeeding actually started mentally, mommy prepared for breastfeeding. So that is actually a choice that a mommy must make before. Am I going to breastfeed my baby? No. Or so what will I do? And that is actually what I mostly tell the patients, that God or Allah created us for a certain purpose in life. So if you're mommy, you plan to be pregnant, so your body also will tell you, hi, you will have a baby, and what are you going to feed the baby? So you will actually start with no one else. Breastfeeding, it was created, is there, so you must actually try to feed. Most of the important things I would say about breastfeeding, about breast milk actually, is that it contains the most ever, what you ever can say, nutrients, vitamins for a baby to feed. So that everything that a baby needs since birth is actually the breast milk. And if we look at South Africa, in South Africa, then you will see that South Africa is actually the lowest breastfeeding moms in the country, because mostly of the mommies don't breastfeed exclusively from birth till 6 months. And also, if you're feeding your baby exclusively, means only breast milk. If you start feeding your baby from birth till 6 months exclusively, you will have a more healthier baby. You will have a more calm baby. You will have also a calm mommy, and you will have also advantages that you can also have is decrease diarrhea in babies that breastfeed, decrease respiratory healthiness of babies and stuff. So there's many advantages of breastfeeding that I can say. And if you exclusively breastfeed from birth till 6 months without solid feeds in between, we call it mixed feeding, and water and other feeds that you want to give the baby, that is babies that mostly get sick, and mostly of that babies actually die of diarrhea because of the mixed feeding that they actually give the babies.
Wow, so there's danger in the mixed feeding.
And as you go on, you will see there's a lot of advantages, but you can stop on a certain level, and when they come there, you can tell them, that is what I actually want, and that is how it works, so that they fully actually can prepare themselves for breastfeeding.
So let's kick this off, and now I pose the question, how can mom at this point get breastfeeding off to a good start? Give us some guidance on breastfeeding, and I know the mind frame has to be there. Do we need certain equipment? Do we need to be in firstly the good space to be breastfeeding? So give a guidance to mom on how to take breastfeeding off to a good start.
At our Nesta maternity, we do offer antenatal classes. So many times we have first mom that doesn't know anything about breastfeeding, so it will be actually quite nice if you can attend some of the classes. There we mentally prepare you of what do's and not to do actually with the breastfeeding, and then the mom is actually mentally prepared to breastfeed baby. After birth, we're actually working together with the Department of Health, and there's 10 steps that they actually want us to do. And the first, one of the steps is that half an hour after birth, with no medical problems, you can actually start breastfeeding. That is actually where it starts. Then you got this confident mom, happy mom, actually, oh, my baby is starting to latch. And actually for the mom, you will see you don't need to ask baby or show baby where baby will crawl for the breast. And then baby will actually start latching on you, and that makes it so nice for mommies when they say, oh, it's actually nice to breastfeed, and it bonds you immediately after that.
Wow. So the mindset is the first step.
The mindset is for me very important. If your mindset is, I'm not going to breastfeed because there wasn't assistance for me, there wasn't somebody to help me, I actually can fully understand what moms sometimes do, but I will always ask you, what is the reason that you don't want to breastfeed? So if they're well prepared, the assistance is there maybe from birth till they go home, and even the follow-up postnatal visit, I will say that's a good start for any mom.
So when you talk about assistance, where should that and must that assistance then start?
The assistance actually started as the Department of Health want from us to all the staff in labor wards must be trained. And that is, we must be trained for the 20-hour training. And that is where, if I'm not there, if I'm sometimes busy with something else, most of our staff is there to assist. But they will ask always, where's Auntie Kathy? Call Auntie Kathy. Auntie Kathy must come and help me. And also the staff in labor ward will come and call me to assist them for that part. So.
And often, moms doesn't breastfeed or continue to breastfeed because it is so sore. And the big question comes, is it meant to hurt? Is it actually supposed to be sore?
Breastfeeding is supposed to be a very pleasure. Breastfeeding is supposed to be something that you enjoy and smiling when you look at the baby. So that is actually where it comes in when you come for the antenatal classes. I used to tell them, we cross the bridge till we get there. So there's some certain stuff that I give them, and when the baby is born and they get sore, I said, take off the baby. So I have to show them how to take off the baby and let the baby latch again until it's not sore. If you don't get sore, then the baby latch actually properly.
Okay, so there comes the correct latching on.
The correct latching, correct.
Okay, and you've probably seen our baby on the background with its cup. We're going to be doing a demonstration of how to cup feed your baby, and this now means that you will be omitting any sort of teats, dummies, bottles from your household. It's probably, if you've bought it, it's probably just going to lie there, because Nurse Brandt is going to show us how to cup feed. But so stay tuned to breastfeeding in pregnancy to parenting as we look at exclusively breastfeeding for the first 6 months. Stay with us. Assalamu alaikum, very good day, welcome back. This is Pregnancy to Parenting. Shukran so much for joining us and staying with us. Please do interact with our page called Pregnancy to Parenting. Post your comments, questions and queries or suggestions to the show. We are more than welcome to add it in and make it part of our production, and look at future shows, as we already in season 2 now of very successful Pregnancy to Parenting. We love how you suggest certain content of our show, so please do keep them coming. We have in studio with us Nurse Brandt, a breastfeeding consultant, to guide us on this topic of today, breastfeeding. We have our little baby and the cup with us to demonstrate later on in the show how to cup feed your baby, which means that all dummies, all teats, there might be here and there bottles that you need to store your milk in. We'll be chatting more about the storage of the milk, how to best get the more out of your breast milk supply, all on Pregnancy to Parenting today. Welcome back, Nurse Brandt. Let's continue with breastfeeding and how sometimes you get this negative connotation, and I don't know if you out there have experienced it, that there are just some family and relatives that just feel completely against breastfeeding. How does one handle that, firstly? Because it could be somebody very close to us, maybe a mom or a husband's relative or even a sister, that could be dead against the fact of breastfeeding. How does one handle the negative society's response to breastfeeding?
Oh, that's a very interesting one, and that is one that I actually like. I actually, when they booked for the antenatal classes, there's reasons why I'm doing that. And then I used to say, I don't mind if you bring your mother-in-law or your mother with, and so that they also can learn how breastfeeding, how nice it is to breastfeeding, because technology actually changed so much. So there's new stuff I used to tell them to learn. So eventually, when it's my class, that is the time that I take my chance. And then I will say, no bottles. That is also what the Department of Health is doing, and you can see as it goes. I can remember in the olden days, my mommy used to give a water bottle and then she add enterus dropples and all that fluids in.
The Dutch medicines.
Because we were on formula. We wasn't breastfeed properly, you see. So they interfere with bottles and dummies and stuff. And there I took my chance to say, no dummies. The reason for no dummies, it's not me saying that. The Department of Health say that you mustn't use any dummy, any other artificial teats like pacifiers, nipple seals and stuff like that, because that really totally interfere when you breastfeed a baby. Because I can remember I had one baby also that struggled to feed, and because the mom-in-law said, you can go to the shop, I'm going to give bottle. And when the mom actually go to work and she have to cup feeding, it's actually nice to see how they grow the support groups of the family and stuff. And then they will come and I actually show the mom or the mother-in-law, that is how you cup feed. Can you see how the baby grows? Can you see this is a healthy baby? Can you see the baby is more flexible, the baby is more healthy, no allergies and stuff? And then they actually enjoy it. It's so nice to see the support that they had from family. And the support also, I told them then, when she breastfeed, please leave her alone. That she can learn the techniques and stuff, because they will somewhat tell her, if the baby is crying, you don't have enough milk, give the bottle, give the formula, and that is actually where all started.
That's
but
really
it's
true.
very nice to see in the community that people stick together, so they learn more and they know more. So that is actually for me really a nice thing.
So that now brings us to the next question. And often moms stop breastfeeding, or they have this irritation and just this anxiousness because they feel that they do not have enough milk. How is the best way of producing more breast milk? Is that even possible? And especially when mom is getting ready to go back to work, how can they best get the best out of their breast milk supply?
Oh, I like that one also. I tell them that a baby knows how to do their job.
The baby, okay.
The baby knows how to do their job. You must just allow the baby. Actually, the more the baby latch on the mommies, I will say, the more the production comes out.
Okay.
And if you don't have a stress mom, if you don't have a stress mom, then your production will also flow more fluently. So I will say that the more the baby latch on you, and if you're at work, try to express in between, and so that your production can flowing. And at home, you advise them, or you can come bring them in for me to assistance, so that I can, the one that's look after your baby when you go back to work, to start with cup feeding. So they continue with the cup feeding, your production goes on, and the baby enjoys. So when you come back from work, that was the best ever part for me, when the babies make like this. They can't wait for you to put on, to latch on you, and I feel that is actually the good part. So production, if you had enough milk, sometimes it can maybe that you don't feed your baby correctly, and there is where assistance coming in. So I will actually show this part actually to viewers. When I had my baby, I used to tell them there's two things that you will see a baby. I think that question will also come up, but somewhere in the one, when you feed the baby, you will wonder sometimes, do I have enough milk? Or how must I feed the baby? When will I know how to stop the baby? So I used to tell them, you take Baba, any position. There's so many different positions that the viewers can have to feed your baby. There's this position, there's so many positions, and even the laying down position for the Caesar patient. So then you feed the baby. A baby will start, when the baby starts latching, sometimes you will notice, I used to tell them there's two spits out. It is very important that you must notice. The one spit out is sometimes when the baby makes like this, when she move ahead, but as soon as you move ahead, the baby actually can start doing this because the baby wasn't done. So that means actually that your milk supply coming out too fast and the baby can't latch properly. So they're small, they're very clever actually. And when you want to know if your baby had actually enough on your breast, you feed your baby. I used to tell the patient, take off some of the clothes of the Baba so that the baby can mostly be skin to skin to your body. So what you actually do is you feed your baby. If your baby stop latching on you, just take your fingers, you just do this and remind them, actually, ups, you're busy drinking, I'm waiting for you. And then after a few seconds, you will actually see that the baby starts latching. I can tell you this is not in a book, that is my experience that I had. When the Baba had actually enough, the baby will spit out, and what she do? She will do something like this, and then you will have a sleepy baby, and that means that baby can sleep for 2 to 3 hours if you feed the baby problem. Otherwise you will feed the baby is sleeping, you put the baby down, after 10 minutes the baby drinks again, and then all this, the problems go, oh, I don't have enough milk. Be patient and let Baba do the job. Don't decide it for Baba when he had enough. Important thing also, so that your milk supply also can come, don't put baby 10 minutes, let them feed, and your production will actually really, it will flow normal.
So you're saying don't keep a guide to say, okay, 5 minutes on the one boob, and then you just let them go and feed as much time that they need.
The experience that I had, because there was times that I said, how do you feed your baby? Because sometimes in the first 7 days, baby do lose weight, and sometimes you do have babies that actually lost like 500 grams. And if they lost, then I know there's a problem with the latching. They don't feed the baby correctly. Sometimes people will let the baby sleep from 5 o'clock from 10 o'clock the evening till 5 o'clock the morning and think, oh, this was a very sweet Baba. Ne? It's actually not sweet. You must wake up Baba and put Baba on too late so that Baba can see. But they're so clever. They can do the job. Just allow them to do it.
Okay. Because people, there are lots of excuses and there are lots of reasons that they are picking up to say that my baby is tired and he is sleepy, or she just doesn't want to latch on properly, or I'm calm, I'm in a good space. So then they eventually just give up. And this is the reasons that you're saying, just continue, be patient, persevere, and push through. Baby will attach at the correct position, inshallah.
You know what Sister Persia knows? There was times that patients comes in like 4 times a day. The same day. Sure. That is people that actually wanted to breastfeed. So I'm 24 hours there for them. I will go that mile. There was one, I think she was 19, very young couple, but she wanted to breastfeed. Then it's 8 o'clock. I'll say, come in, I'll assist you. Then they go home. Then it's 11 o'clock, they're back again. And so it goes every day through the day, but really it's very nice to see. So if the mom is very positive, don't feel like you're going to stop. Go for assistance, because there is assistance all over for breastfeeding.
Okay, so another question that has come in as well is how much milk is enough for the baby? So from day 1 up until maybe 6 months, I know the amount then changes from whether mom's going back to work when the baby's about 4 to 6 months or so. So then a different amount would then be given. Do we measure the amounts, or do we also just continue feeding? If we are calculating, we now express, and they say there's 5 or 10 mils in the not in the bottle but in the cup rather, and we are cup feeding baby. Just give us some sort of guide by. Because okay, there are some certain areas where baby is because of sickness or medical reasons, baby is not going to breastfeed at all. Then you can actually measure the formula, how much baby is getting, and even on the tin formulas they explain. So just explain to us with regards to breast milk, and you're saying don't limit it just to 5 or 10 minutes on one boob. Do it till when baby is done feeding. So guide us through how much mils about baby should be getting enough milk, and how long that will be taking via breastfeeding as well.
We actually recommend it that moms start breastfeeding if they can from 1 to 6 months.
All right.
Exclusively, with no other feeding in between. So if the mom actually feed the baby for that 1 to 6 months on demanding, and demanding means whenever the baby wants its demand, you give the baby.
You give the baby.
And there it comes in. So when you feed your baby properly, that baby will have enough milk. But I actually do, where the people that go to work, I actually ask them to bring in the nanny and the mom, and then I work out, not formula, I work out express breast milk, the amount the baby should, they must give the baby according their weight. So they express that milk and give it for baby, so when they come back from work, the baby starts latching. Because if you see, in a few months, then the baby is 6 months, and then they can hold their own cup. Isn't that nice?
Are you kidding?
So then they hold their own cups, and you actually start after 6 months with solid foods. That's actually nice.
Thank you so much, Nurse Brunt. A completely different way of looking at breastfeeding and feeding baby. An absolute pleasure to bring this information out to our viewers as well. We will continue on breastfeeding and teaching moms how to rather cup feed, getting rid of the dummies and the teats and the years and years of trying to get rid of baby on that dummy again afterwards, even after baby's done breastfeeding. So more after the show, so after the break, stay with us. Assalamu alaikum, a very good day to you. Welcome back. This is Pregnancy to Parenting, as you can see, and we're talking breastfeeding, and I'm sure there's lots of questions and queries with regards to cup feeding. I'd like to hear your breastfeeding story. If you've heard of cup feeding, have you tried cup feeding? To post on our Facebook page, Pregnancy to Parenting, and your comment might just teach or allow another mom to learn something, inshallah. With me is Nesbrand, often called Auntie Kathy. As you can hear, she gets calls all the times, weird odd hours of the day, but it is about being passionate to get moms to breastfeed. We have our little Baba. We haven't named the Baba yet. We have our little Baba with
Tatum.
us. Oh, Tatum.
Tatum
Okay.
was called Patience Child.
So Tatum is in studio with us as well, and Tatum is our dummy doll to teach us how to cup feed and also just demonstrate different ways of breastfeeding and positions and stuff.
Okay.
Just go through that again, Nurse Brunt, the positions of breastfeeding, because you said there are some cesarean moms who can lie down and breastfeed as well.
Yeah.
There's the left and the right and the underarm. Just show us again the different positions of breastfeeding.
The lying down position is actually for moms. It's a very comfortable way for moms to breastfeed when they lay on your side, and then you actually lying to this and your baby starts latching. That is a comfortable position for people that has a seizure, because so then the baby is not actually in the way of the seizure because they're sitting here. And even so, sometimes seizure patients it's very painful and it's very sore, and so that was a position that I mostly like for moms. Mostly patients come in and they lay there for the whole day, so I don't mind as long as they breastfeed. Then we got the other normal way that comes maybe from the olden days. This is and please viewers, if you can take this scissor position away, I hate that position. So when they put on and they put the baby like that, you can just hold your breast like, see Kathy, and you just hold your breast and put it in, and baby will let. Then you got this position, the football position. This is also a nice position. You can do it from both sides. You can even feed a twin baby like this, the one on the other one and the one like that. And that is actually nice positions. A lot of positions, I don't mind at all which position a patient is using, as long as it's comfortable and a baby's feeding for me properly. I don't mind at all.
And baby is latching on.
Baby is latching properly. But if you had problems with cracked nipples, sore nipples, please go for assistance, because sometimes people go for lasers, but after 2 days you will see that your nipple gets sore again. And the reason for that, it will continuously because your baby isn't latched properly. Go for help, and then I think from there, and it will go much better.
Ms. Brunt, is there any specific advice that you could give to moms that are breastfeeding with regards to the preparation of their breast and their nipples? I was always advised sometimes just using the actual milk that is excreting out of the breast milk and rub it on any sore or cracked nipples. What would you say before breastfeeding? Does one have to specially prepare your breast or your nipples?
As it starts now, I can remember now the latest course that we had on, they actually said that you don't need to prepare. But when I start nursing, there was one position that I would like, and that is where you get moms with inverted nipples. I can remember me and Sister Fausia had that patient one day, and that was actually, she was 37 weeks, and she was so shy to tell in front of other people. So I used to tell them at the antenatal class, if you have one personal question, come words and ask me. And she had inverted nipples, so that's the reason she didn't breastfeed the previous child. And I said, okay, you come, you prepare your nipples, and that is like a position that you have to pull your nipple to the front. When you sit in the bath, and you can actually roll it so in your finger and pull it forward to prepare your nipples in. You won't believe it, but it's true. The next week, the patient actually go into labor, and then that baby latched for the first time. That is actually the mile that you want to go with patients that really wanted to breastfeed. I don't mind to set it off for how long, but if the patient wants to breastfeed, I will do everything. And the other thing is I want to add there for mommies, don't put artificial teats.
So the dummies and stuff.
Dummies in. I had a patient in this week. As baby don't want to breastfeed, and I couldn't understand what's wrong. Her nipples looks fine, and I asked her, okay, let me put on, but the baby just you don't want to open his crank. And I thought, okay, something else must be wrong. I checked the reflux of the baby to see how the baby latched on my finger. Nothing. But there must be something else. And then her bag was just standing there. And then I see the culprit. It was actually the bottle. And then I said, are you giving the baby bottle? And she said, sometimes. Yeah. And when I took the bottle, I said, let me show you something. It's not because we actually force people to do breastfeeding. There is times medically indicated that we actually say, if it's medically indicated, you can go to a formula. And when I put that bottle in the baby's mouth, it was unbelievable. That baby latched, and the baby was 5 days off from the breast. So that baby actually let a drink on that bottle that it feels like he's going to get a diploma for it. Ne? So the baby led so well on that bottle, and I struggled really. It was hard work. By the end, sometimes it's hard work to take the baby then off from the bottle, because 5 days on a bottle is hard work. So what I did, I showed Sister Folder, come and have a look here. And I put a bottle tit on the breast. And you won't believe it. And that baby latched, and the milk supply comes on, and the baby latched. And then I told the mom, you know what? After a while, you take off the tit, and then the baby latched. And it actually comes after they 3, the baby actually latched well. So sometimes it's not Baba that's the culprit. I will see it's the moms, because they introduce it to Baba.
That's a very interesting story. Yes. And it so happened that the baby started breastfeeding.
They start latching.
Even after 5 days of not breastfeeding.
We can actually start.
Was it a very young baby?
It was 7 days old.
Wow. Okay.
So that's why we said it starts from bonding in labor ward, half an hour after, but it actually starts there. But it was also first baby, so if there wasn't assistance, they will do whatever. Yeah. But then they come and try you, but I can see this is not a breast baby, this one. So it's actually nice to see.
Yes, and we have Tatum in studio with us as well as demonstrating. So another question is, how often, as you've said earlier on, baby should be feeding on demand? So the big question is also, how often should we be feeding baby, and can mom ever overfeed baby?
Not with breastfeeding.
Okay.
I used to tell the patient that 5 ml cholesterol in the beginning is equal to 30 ml of formula.
So 5 milliliters.
5 ml, a teaspoon.
Oh, a teaspoon.
A teaspoon
of the cholesterol, which is the cholesterol.
Is equal to 30 ml. So you can't actually overfeed that baby.
Okay.
So you can feed the baby actually whenever the baby wants, like you demanding tea, you feed the baby. But if you feed the baby correctly, on demanding, the baby will have enough and your baby will sleep at least for 2 to 3 hours. But we don't recommend or tell patients that you must feed your baby every 3 hours. It's because baby sleeps mostly then for 2 to 3 hours. So then mommies will say, I feed her every 2 to 3 hours. It means actually, so feed the baby correctly, so feed the baby properly, and the baby had actually enough. Well,
okay.
So you can't overfeed a breast baby, not at all. And breast babies also don't get constipated. Sometimes you will see, we don't mind if a breast baby sometimes skip stools for 2 to 3 days because breast milk, by the 3rd day we said, then you call Al-Nisa, then they call and say, no, Sister Katie, baby did poo, but with formula babies you can see they get constipated because mummies too overfed them.
Okay, so how do we also know, as you've explained earlier, but how do we really know when baby is hungry, still hungry, and when baby is full?
Yeah, sometimes you will see if your baby, if the mummy feed the baby correctly.
Okay.
It's not always about feeding. I used to tell them sometimes babies just need a little bit bonding. That is all sometimes that baby needs. Sometimes it's just maybe a win, but sometimes a baby just needs little comfort. So it's not always about having crying for milk. Look for other reasons. For other reasons that you can see babies crying. I used to tell them skin to skin bonding. That is maybe what they want. A calm mom is not always about crying and feeding. That the baby cry, the baby see if the baby is not wet. They're so clever. They cry some for a wet nappy and stuff like that. So see them. But definitely baby will look, if they're hungry, they will look for the breast, and then you know if you put them on and the latch, it's okay.
Okay. So a good guide for helping moms to understand when and how to feed baby, whether the baby is still hungry or full, is to feel. Eliminate all the other extras where the baby needs to cuddle, hold baby close, as Sister Branda said.
Daddies can also do that.
Okay, so to give mom a break, daddies can also hold baby.
Can also skin to skin, yeah.
And then also check baby's nappy, and if all of that is sorted, then baby still wants to feed, then baby's still hungry. All right, we'll continue with breastfeeding after the short break. Stay with us, as a very interesting bit comes up about when it comes to cup feeding, more after the short break. Assalamu alaikum, welcome back in our last segment as we deal with breastfeeding, and probably not the last on this subject. I'm Khawa Solomon, and thank you so much, Shukran, for joining us in our continued series of Pregnancy to Parenting. I have Nurse Brunt with me, who's specialized in breastfeeding consultant training and is currently based at Al Nisa Maternity Home. And very soon we're going to be getting into the nitty-gritties of cup feeding. Alhamdulillah, she even allows, when mom goes back to work, not to confuse baby and implement the dummy or the bottle feeding, to then train mom or mom's mother or mom's mother, whoever's going to take care of the baby, the nanny in fact, to come in and give the necessary training to that individual who's looking after baby with the cup feeding. So let's just focus a little bit on mom and where things could possibly go wrong, Nurse Brunt. Latching is a big problem, and that's probably one of the biggest problems when it comes to not wanting to breastfeed for as long as you can. Talk to us about the certain instances where latching causes the problem and how one can fix it.
Latching actually start problems with moms getting sore, sore nipples.
Okay.
And cracked nipples as something that they don't enjoy.
Yeah, so that comes with it does breastfeeding hurt.
Yeah. And I will say, if they're struggling, it can be tiring. Because you know what I used to tell people, then we act like an octopus. We want to do so many stuff at home. We want to clean the house, we want to do the washing, we want to do everything, but we actually forgot about ourselves. We're so tiring at the end when your husband comes home. You're so tired when your husband comes home because you're crying. I got mommies that actually fell into depression because they can't cope with everything.
Yeah.
But I used to tell them, you're looking for so long after your husband and your family. So now it's time to look after yourself. Take your time. You can clean the house afterwards. You can do the clothing or the washing, ironing, everything afterwards takes your time, because that is where the problem's starting. You're getting depressed, you're getting stressful, and because of that, baby also gets stressful. You will get a crying baby, and mommy will also crying. So when daddy steps in there by the door, the first thing, I can't cope, is too much for me. So that's actually where problems starting actually with breastfeeding, I will say mostly, and also interference with artificial stuff.
Okay.
If you want to breastfeed your baby exclusively, breastfeed your baby exclusively. That means only breast milk. You can cup feed in between you're at home, but not always when you're at home. When you want to go out, maybe, you can ask your husband to stay with Baba and cup feed Baba. He can do that. And the bottle, put it aside, is very expensive. I've got so many dummies there at work. It was not taken away, it was sponsored. Because people do have problems with breastfeeding, and then one person actually asked them for her husband, take out the lifesaver, and I was so angry to see what is the lifesaver, and it's a dummy. And in the olden days, people used to say it's a fopspien in Afrikaans, so you actually fop the baby by putting everything. I can even put my finger in and the baby will start suckling everything. So small things, but it comes later and it gets worse, and then baby don't want to drink, and there's where problems started actually with latching problems.
Okay. Okay. Does mom have to have a special diet when it comes to breastfeeding?
I will say actually no. You can actually just try to eat healthy. Like people say you mustn't eat curry because your baby will get yellow. You can eat curry, but just keep it mild, not so much overdo curry.
Okay.
Caffeine, don't overdo your stuff. And that is actually where they actually started, just a healthy diet.
How does mom know and can pick up when breastfeeding has gone wrong and when she should exactly go for help? Because as earlier you've mentioned of the instance of the baby not wanting to take breast milk and 5 days later baby's still not wanting to. So guide us on when you can pick up, when moms are picking up when things have gone wrong, and when and how to be approaching someone for help.
I will actually say it actually goes well in hospital or where you get assistance, for especially for the first moms. But when they got home, there's so much interference with the mother, the mother-in-law, because some people that had kids will tell you, do this, give this, and so on. Leave mommy, because if you go home and the problem starts, call immediately for help, because that is actually the time that you need assistance, that everything can go well. Now you wait 7 days, you wait 14 days, you come back, you want to relapse. We don't mind to use it, but unfortunately, if we start the problem from the beginning, it actually should have made a great point.
Okay, great. So the next step, of course, when mommy is going back to work is expressing. Just guide us through the best ways to express milk, to store it, how can we store it, and what is about the amount that baby would need when mommy goes back to work?
I actually advise people that if they go to work, as I say, to express at work and to do cup feeding. So I actually ask them to bring the nanny and mom with, but they can express at work and they can put it in the fridge there, because it can stay there for a certain time, 6 to 8 hours, you can put it there. And when they go home, so every day you actually express. So every day, the more you express, your production continues. So then you can give that express milk, the amount that is working out according to baby levels. You give that for the nanny or the mom to give the next day for Baba. And then your production. And if you're at home, don't give cup feeding. You give only exclusively breastfeeding.
Because it will confuse baby, because they smell you, but you're giving a cup.
They can give the cup, what I mean, so that the production actually can continue. So when the mom is at home, you continue with breastfeeding. So then your production continue, and when you leave, the milk that you express for the nanny for the next day.
Okay, so I know people sometimes feel very uncomfortable about breastfeeding in public, and I mean, I love breastfeeding, but you always feel so isolated when you have to go into another room and go and breastfeed baby. How can one try and resolve that isolation? I mean, baby's right there with you, so just guide us with some advice of not feeling so alone when you're breastfeeding.
Oh, I like that one. I used to tell them, if you actually want a Coke or you want a pie, you in the mall, you go and you buy and you eat. But the baby also won't ask you on a certain time, I want now. So there's actually Muslim people also have that nice scarf that they had that they can just put on. You can use a blanket. And actually a lady gave me, I don't know what you call it, but it's something that is over here. It's like a piping. And then it covers the baby totally. And then you can continue. So when they're in the mall, you can sit there. You can see your breastfeeding, but nobody can see what are you doing. So that is actually a good thing. And that depends actually totally from you as a mom. I can remember there was such a young mommy that was so cute. She came in there with a scarf. And she's so young. And I said, what are you doing? Now I'm breastfeeding my baby. And she had a scarf on and the baby's latching. And she goes out by the door by our knees. I'm still continuing breastfeeding. She said, it's my baby, but she is covered. So you can make it for you comfortable to see. Don't feel like, oh, I can't breastfeed. Make it comfortable. There is something that you can use if you really want to breastfeed. Because sometimes people use that excuse. I can't breastfeed in the public. But there's a lot of stuff that you can use to cover yourself.
Okay, so we've left the best for last, and now we finally like Nurse Brandt to please explain to us the process of cup feeding.
Okay, let me use Tatum. And daddy, the viewers must always remember that daddy can also cup feeding. I had so many daddies that cup feed, and that is excellent for me.
Okay.
So you do express the milk, and you can use your bottle. Use it to express and put your milk in there, but you use the top of the bottle to actually give the milk to Baba.
So it's the actual bottle, the baby's bottle.
The baby's bottle, yeah, because it's nice, but a plastic container is actually nice, yeah. Any container that is plastic, but mostly for the cup, people used to use the bottle.
Yeah.
They express it in the bottle, but they use the cup.
Okay.
To feed the baby.
The cap of the bottle.
Yeah, the cap, yeah, that one. So then you just hold the baby a little bit backwards.
This baby's very stiff.
Yeah, a little bit backwards. You wait, baby. Well, it's so nice to see that baby actually open the mouth themselves. You don't need to ask them to open, or you don't need to open the baby's mouth. So you can just take the cup, put it on the tongue of the Baba, and as soon as the baby starts suckling, you just lift your cup slowly, but in between, you can actually stop. That baby will have a breathe. Sometimes you will see that baby mess a little bit on the clothes, but that's fine because mostly our babies got a lot of clothes, so you don't need to worry about that. And then you continue. Some babies even don't mess on their clothes, they just drink it. And so after 2 weeks or so, what I notice is that babies do this. It's so nice to see. They do this. It's actually they want to help you the same that they would like to touch the breast. So they just do that and put their hands together. So wow, I can do it. And then 6 months, you don't sit with a bottle, you sit with a cup, and they can walk around with cup.
Brilliant.
So it's actually very nice. If you want to, you can do it.
Yeah, it doesn't look that difficult, but it's always different when one is actually doing it yourself. So when you're doing it yourself, as Nurse Brandt, is it really that bad?
No, because I've got that experience, so that's why I won't introduce a cup feeding to a mommy if I don't show her how to do it, because it's very important that you show her how to do it, what to do, when to stop and stuff like that. So I won't send them home and say you cup feed. I will ask them, do you know how to cup feed? And from there on, it went well.
In conclusion, we have to wrap up. 60 seconds left, Nurse Brandt. It's been an absolute pleasure having you in studio with us with all the information you've given us on your experience in breastfeeding and pushing, to mommies, for mommies to breastfeeding. In your last words, please leave some very helpful advice to our mommies that are thinking of breastfeeding, having problems with breastfeeding, and just, or doing it very well as well.
I like breastfeeding. You know what? I've got my firstborn is 23, the other one is 19, and then I've got a late born of 5 years old. Let me go quickly through it. The first one was breastfeeding for nearly 2 years, and she started walking 7 months. The other one was mixed feed, but also he started, for a long period I breastfeed him, and he also started walking 7 months. With my premature baby, he was a premature one, and he nearly died because I have to, you're so dedicated to your job. You're so dedicated to go back to work, so I will plea actually to moms. See what your first priority is. If it's your baby, because my baby was premature, and when they asked me to go back to work, I actually go, and then baby was like 3.5 months. So then that was actually recommended that I start with formula, and I tried the formula that I thought was the best ever, because it's 19 years and the other one so. And then he actually got diarrhea, and he nearly died of the diarrhea. And I feel so ashamed for me not be so dedicated to my Baba. I was more dedicated to the work, to go back to work. And after that, my patients start, and I will say, if I can, I will really assist every mom that wants to breastfeed with breastfeeding. And breast is best.
Is best.
That I can say.
Thank you so much, Nurse Brandt, Sister Kathy, Auntie Kathy, a breastfeeding consultant at Al Nisa, who everybody loves and adores. May the Almighty continue giving you the necessary strength to continue in the best manner that you're doing what you are doing.
And just the last word, if they had any problems and they don't know where to go to, I do have patients from private sectors that comes to me, and then you can call Al Nisa at 021 696 8892. I had also a twins, just for interesting, a twin baby. They was so small premature. The one was 1.6 and the one was 1.7. Okay. And I introduced cup feeding to the mom, and every week when that baby comes, that baby gain and the baby gain. So I actually discharged the baby when the baby was 3.5 and said, Auntie Kathy, don't want to see you again. So the grandma also came, and the grandma said, I want to see Auntie Kathy. Yeah. And she's older than me, but she calls me Auntie Kathy, so it's actually nice bonding. Yeah. You got so a family-like to your patients, like a mom, and that's so you can do it if you want to breastfeed mommies.
With all of that assurance, Auntie Kathy, there's no doubt that our moms are definitely going to breastfeed, so we really thank you and appreciate for all your kind words and assurance that breastfeeding is the best and it will work. We hope to see you soon one day again on Pregnancy to Parenting as a feature, and Tatum as well, thank you. And also to Al-Nisa for hosting you here today. Thank you very much. Enjoy your day.
Thank you so much. It was a
Goodbye.
pleasure.
That was Nurse Brand, Sister Kathy, Auntie Kathy from Al-Nisa Maternity Home, breastfeeding consultant, in studio with us, chatting to us about breastfeeding. Please do interact with our Facebook page, Pregnancy to Parenting, and leave your comments. From myself, Hawa Solomon, a very good day to you and goodbye for now.